spirit. And so I am super jazzed to have with us today Dr. Lewis, and she's going to be kind of walking us through a little bit on naturopathic approaches to women's health, and then leave some time for questions and answers. So if you have any questions, please feel free to shoot them over our way. And now I'm going to make my video go away and turn it over to Dr. Lewis. Dr. Lewis, welcome and thank you for coming.
Hi, everyone. It's such a pleasure to be here today and speaking with you from sunny Connecticut. I thought we would start out the talk and give a little introduction to who I am, what I do, how I got into this field, and that should serve as a little introduction to a couple of cases that I'd love to go through with you. I open the floor for any questions at the end, and I encourage you to just throw those all out there, okay? So a little bit of a background on myself. I have a general family practice here in Westport, Connecticut. I also serve as clinical faculty and academic faculty over at University of Bridgeport, which is the naturopathic college here in Connecticut, not too far from me. And over there, I work on both overseeing in the clinic, 3rd and 4th year naturopathic medical students who are starting to see patients in the clinic. Patients really benefit there because they get that community approach. They get all of these students that are fresh in the program, learning all this information, all new, cutting edge, and we get to put all that information together, all our heads together, and really give them comprehensive care. So I have such a privilege being able to work over there. And then obviously being able to teach on the academic side is such a gift as well. And then, of course, being in my private practice, you know, it's been quite a journey to get here, and I'd love to share a little bit about that journey. As was mentioned, you know, I started out, my undergraduate degree was at Boston University. I studied sports medicine and athletic training, really working with doing prevention and rehabilitation of athletic injuries. Interestingly, a lot of people ask me how I got into naturopathic medicine. And, you know, I think many of my colleagues will say that they grew up on natural medicine, they had these old home remedies, and I had a little bit of that, but admittedly, I grew up on Western medicine. So I'm sure that's the case for many of you out there. You know, it was a sore throat and you got antibiotics, but you know what, I always questioned that, and I always knew that there was something more out there for patients. And through my own experiences being a competitive athlete and just a passion for learning about nutrition and exercise and seeing the impact of that on my own health, my family's health, and the people around me, that's really kind of what led me down my route. Now, while at Boston University, you know, I was working with athletes, and it was only natural that I wanted to expand the population that I was working with. I eventually went into personal training, ran a personal training program up in Cambridge, Massachusetts, and really there got to see the impact of diet and lifestyle and how that transformed people's lives. You know, it's unusual for a career for one type of professional to work with somebody, you know, 2 hours, 3 hours per week. You get to really know a person, and then really getting to see those people make those changes. But it was there I started to ask a bigger question. I saw people get better, but you know, maybe it was only 80% or 90%. And I knew there was something more that was missing, and there was something more that I could offer to those patients. And through a family ordeal, my mom had a very rare thyroid condition, was incredibly symptomatic at the time. She sought the care of a naturopathic physician and shared her experience with me. And the naturopathic physician was actually who uncovered the condition. Later, we went on to find out that were 28 people in our family affected by this, which is a precursor to thyroid cancer. And so at that time, it really just opened my eyes. It was like the light bulb people talk about that goes off. And I began to start to explore naturopathic medicine and uncovered this whole world that actually has been around for so long, the beginning of medicine. So packed my bags and I was off to National College of Natural Medicine, or National University of Natural Medicine now. And while there, I participated in research studies looking at the effects of the blood type diet on patients and various other studies working to really define some of the, do some research around the benefits of natural medicine. While there, You know, people ask me, how did you get into women's health? Well, that's not originally what I went there for, but I will never forget that moment when I was in my gynecology class, my gynecology lab, and we were learning our practical on how to do a well woman's exam. And I remember inserting that speculum for the first time, opening the speculum and seeing the cervix. And I just thought, holy cow, or maybe I used another word than that. I was in such shock that that was a part of our body and what it looked like. And I think more than that, I was just so surprised that all those years that I had gone for my annual well woman's exam, paranoid, uncomfortable having my exam, not knowing what the heck they were doing, I thought, wow, this all just makes so much more sense to me. And I knew there was a new way to do exams for women, a new way that we can care for women. And that's what really opened that path for me in women's health. I then went on to study with Dr. Jennifer Gibbons, a wonderful naturopathic midwife. I did a certificate in midwifery while I was out there. So I attended home births. I also attended births in the birth center, and really just doing comprehensive care for women and also pediatrics. Following school, I stayed out in Oregon. I completed my residency there at National University of Natural Medicine. It was a general family practice residency, but we also had the opportunity to do work in community health clinics and really working with underserved populations and bringing this medicine to them. So it was a very wide range of experience that I got there. Then, packed my bags. I had the calling again. My family is all back out here on the East Coast, and I will say that the West Coast always seemed a little bit more on top of things as far as when it comes to natural medicine. But there's definitely a presence out here, and there's definitely a calling for who we are and what we do. So my husband and I moved here back east, and I opened the clinic, Shalva Clinic, where I get the privilege of working with some really wonderful colleagues who also have some general niche areas that they focus on. Additional training that I've done afterwards, what's nice about being a naturopathic physician, you have this huge amount of tools in the tool belt. And each naturopathic physician that you talk to might use one tool more than the other. And they might have a few different tools in their toolbox. So a few of those tools that are there for me, I did some extra training and working with pelvic floor therapy. Pelvic floor therapy is, there's different techniques, both working on physical and emotional levels, women who've had pelvic pain or chronic pelvic pain, any type of sexual dysfunction. Those are all different issues that we can be able to work on both on a physical level and then also on an emotional and energetic level as well. I've also done some extensive training in utilizing homeopathy, which is another tool, we're not going to go into fully here, but just another tool in the tool belt. And then I think it's always nice for you to know just kind of a little bit about me and what I do on my side. I'm an avid tennis player. It's something that I only started in the last 5 years or so, but when you see 80-year-olds out on the court, that's something that I can do for a lifetime. And so it got me into that, and I do a lot of hiking with my husband and my dog, and lots of outdoor activities here. So let me tell you, many of you may be familiar with what a naturopathic visit looks like, but many of you may not be, and I want to share with you what the visit actually looks like. So I always offer to my prospective patients that are looking to come in an opportunity for complimentary consultation. It's a great opportunity for me to get to know them, share some information about my approach and what it's like to be working with me. One of the questions that many people, I think, is in their mind, if they're, there's a couple different types of people that come into naturopathic medicine. One is the group of people that are really frustrated with their health and they just don't know where to go. They're kind of at the end of the line. They've exhausted all the conventional options and it's kind of their last option. I wish that weren't the case, but that is a part of the group of people. The other group of people are people that it already just aligns with their way of life. They tend to lead a more holistic lifestyle, and it just aligns with that. I obviously work with both. So consultation is a great way for them to come in. They can either come into the office, we can do it by phone. and just as a way to get the conversation started. Before the patient actually even comes into my office, we welcome them into that process. We welcome them into our clinic. We really become their family here. So we have a great administrative team that works with them. We have a comprehensive intake form that patients will fill out. Now, we're not just talking privacy forms and your name and address. I ask lots of nosy questions that really get into diet, lifestyle, what they're doing on a day-to-day. I really want to get to know my patients. Every patient that comes in with a migraine or digestive issues or PMS or whatever the complaint is, they're all different. No patient that has migraines has a migraine for the same reason. So I start that process by really being able to read through that intake before they even come in for their visit. Certainly if they send in any labs or imaging, I'll review all of that ahead of time. And that helps serve as the foundation for when they come in for the visit. I have a nice starting point. When they come in for that visit, so it's not a 15-minute visit, my first appointment's 90 minutes, and probably about 80 to 85 of those minutes, I'm sitting face-to-face with my patient. We'll spend the first half filling in the gaps. I already know them. They might have come in for a consultation, but I've definitely read their story that they shared with me in their intake. And then I'm just filling in the gaps, just trying to get to know them, asking clarifying questions. And then during the second half of the visit is when I do the physical exams, just like your conventional doctor would. And then we put together a plan. A plan might include additional laboratory studies. I oftentimes find that when a patient comes in with prior labs, it's often just a part of the picture. You know, they might just look at one marker for indicating thyroid function, where I might look at 7 or 8 different markers because I want to know what's happening upstream, midstream, or downstream. You know, and then in addition to the laboratory, the general labs, I might do some specialty labs. So for hormone testing, rather than just doing hormones one day of their cycle, we know hormones change day to day. So I might do hormone testing that looks at them, mapping them throughout their entire cycle. A digestive test. I might do a digestive analysis that looks at not just how they're, if there's bacteria present or parasite present, but we'll look at how their digestive function is, how their enzymes are working. Was there any inflammatory markers? How is their body being able to break down food? What's the balance of good bacteria in the gut? Because we know that there's a presence or should be a presence of good bacteria. And then is there any pathogenic bugs, bacteria, virus, parasites going on? So it's a very comprehensive test that we can do with this. One of the things that providers say, one of the reasons why they don't do the additional testing, which would provide a foundation for doing a more individualized, comprehensive treatment plan for patients, one of the biggest reasons is doctors don't have time. They don't have time to review the results. And for me, that's not a good enough reason, you know, so we really go through it. At the end of that first visit, we will put together their plan. Certainly if I feel a medication is indicated, we'll talk about that, but most patients are coming to me because they want a more holistic approach. So I'll utilize homeopathy, diet, lifestyle. We'll work on stress management if that's a factor. I might use herbs, and I can do those in teas and tinctures and capsules in all different forms. Herbs have been used since the beginning of time, and believe it or not, many of our medications come from herbs. I'll also use directed nutrient therapy and many of the other adjunctive therapies, whether it's physical medicine like a chiropractor or similar to a physical therapist might do. We put together a really comprehensive plan. And then at the end of that, do we just say, oh, here you go, have a nice day? No, we want to see them back. So I like to see my patients back within a month. I'm very results focused, and I want to know what we're doing is working. Usually my first follow-up is about 1 hour, and the first 2 appointments are always the most important. The first visit is our information gathering, and our second visit is really refining what it is that we're doing. In that second visit, we'll review any of those specialized tests, labs, refine their diagnosis or what I think is going on, and then refine their treatment plan. Then as far as follow-up after that, it really depends on what's going on with the patient. More complicated cases might require more regular follow-up. Some people just use me to check in. Some it's just their annual physical or gynecological exam. I'm here to serve patients in a variety of capacity and meet them where they're at and what they're looking for. Some people they're in a great state of health and they just want to take it to the next level. Other people are very sick. They've been dealing with chronic autoimmune disease or infectious disease like Lyme disease. We see a lot here. Many of them are very ill and really need somebody that's going to take the time and stand by them, and it oftentimes will take a little while to get them to recover. So once the patient is in, okay, what are these patients coming in for? Well, as I mentioned, a whole host of complaints. I have a general family practice, but one of my number one passions is really working with women. So PMS. We've all probably heard about PMS or experienced one or so symptoms of PMS. When we think about PMS or how we diagnose PMS is based on when the symptoms are occurring and where in your cycle, where in the cycle they're occurring and what type of symptoms a patient is experiencing. A menstrual cycle runs on average 28 to 29 days. Coincidentally, that's the same amount of days as the lunar cycle. Go figure, this whole world is connected. So you'll see I'll talk about that in a minute, but we oftentimes find when a patient has irregular cycles, we can actually get them cycling to the moon and it will help their cycles normalize, and there's different ways that we can do it. So when we think about PMS, the cycle is divided, or just in general, our menstrual cycles are divided into a couple of phases. When we count the days of our cycle, day 1 is the day that we start our menstrual bleed. Generally from day 1 to day 14, and this is on average, it's going to vary from person to person, but day 1 to day 14 is that follicular phase. After that, or right on the mid-cycle, is when ovulation occurs. That's when the egg is released. It's the time around that is our fertile window. It's the time that we're most fertile.
Dr. Lewis, I'm sorry to bother you, but your home screen is the one that's still showing for some people.
Oh.
I'm seeing the correct one, but can somebody just give me feedback and make sure that everybody is seeing?
Let me see.
I see all of them now. There's your case study. Yep, we're good.
Is it working?
Yes.
How about
perfect.
Now?
Yes. Sorry.
What you did.
Okay.
I hit the right button. So on the second half of the cycle is what's known as the luteal phase. So that's day 14 to the last day of your cycle or the day before you start your next bleed. So during that luteal phase is when the symptoms, if we're seeing a presence of symptoms occurring during that phase, and it's leading to some impairment in function, that's what we would consider PMS or premenstrual syndrome. If a patient has an affective symptom, meaning a symptom related to their mood, we might consider diagnoses such as PMDD, which is premenstrual dystrophic disorder. We're not going to go into detail about that here, but just to know that that does exist. Okay, we probably don't need to go through this, but what are some symptoms of PMS? So certainly any type of mood, irritability, mood changes, sensitivity, crying spells. People might have some difficulty falling asleep. They might feel withdrawn. It's a time to go inward for patients. In many other countries, or when we look historically at women during their menstrual cycle, this was a very sacred time for women, actually, during their cycle. There's a book called The Red Tent, which is a wonderful book that speaks of this. Also, during that luteal phase, they might experience some physical symptoms: fatigue, bloating, weight gain, breast tenderness, acne, digestive changes. It's oftentimes somebody might come in with their chief complaint is loose stools, and when we actually connect it to the timing of their cycle, we find, oh, it's really just happening in that week before. Some people are just more sensitive to those hormones, but there's ways that we can support all of these symptoms that are happening. Any type of joint pain, and of course headaches. So Had a case this is hot off the press just recently. I just had a follow-up with her a couple of weeks ago. 30-year-old female. She had gradually worsening PMS over the last 1 to 2 years prior. What's interesting about this patient is she went her whole lifetime really not having a lot of symptoms. And then over these last couple of years, she started to experience some symptoms and just appeared to be getting worse and worse and worse. So she came into my office. What had been recommended to her prior was just to go on the birth control pill, which she had tried in the past and had some adverse reactions to it and just really didn't like how she was feeling and wanted to try a more holistic approach. Her main symptoms were bloating, significant breast tenderness. She increased emotional sensitivity and sadness that was impacting her day-to-day life. It was impacting her relationship, her work, and it was coming on about a week prior to her menstrual cycle beginning, which is the luteal phase when her symptoms were occurring. And then that would resolve right at the stop of her cycle. She also notably, she was working in a new position that was she was working many, many hours, 65, 70 hours a week. She had increased her coffee consumption per day. In her office, they had a whole food center and coffee available all day long. So she's drinking about 4 to 6 cups of coffee per day. I'm sure those were quite generous cups as well. She was no longer getting any exercise in. So we had done an initial, I had her fill out. I wanted to get her tracking her cycles, starting to get a sense of where her symptoms were falling and just creating some more awareness about her day-to-day feeling and how she can connect that to her lifestyle. We also did some laboratory evaluation. We looked at her thyroid. We did a blood count that's screening for some different signs of anemias, whether it's iron or B12 or folate, which is known as B9. All of these studies we did, everything was actually normal. She had come in, she had some prior hormone testing that was done, everything was normal. So we just said, let's just do some initial treatment. One of the old remedies that we know of for helping with the breast, I had done a physical exam. She had some what we would call fibrocystic changes in her breasts. A remedy that we often think of for this is poke root oil. Poke root is a botanical, also known as phytolacca. I had her start to apply this topically to her breasts in the couple weeks kind of leading up or, following ovulation during that second half of her cycle. Once a day, and then on the days that she was having tenderness, she increased that up to as needed, which I think she was doing about a couple times a day. I walked her through a gradual reduction in the coffee consumption and followed by a complete elimination. We didn't go cold turkey, but we gradually reduced that down. We did a series of substituting in decaffeinated coffees and teas. It was quite a process actually for her over the course of a few weeks. I had her start on some vitamin E. We did a high potency ultra gamma E, which is mixed tocopherols. They're well researched and helping to improve pain and the severity of this cyclic breast tenderness. I also had her start using Vitex or taking Vitex. This is also known as chase tree berry. It's an herb and a wonderful herb. It's a tonifying herb for the female hormonal system. And so she started taking this. Once she took 1 capsule per day. I actually had her do it all cycle long, but sometimes we'll just have people do it during the second half of their cycle. And then we just start working in exercise. She was doing a minimum of 30 minutes of exercise 3 days per week. Fortunately, she had access to a gym in her facility or her work, which was amazing. And so we were able to work that into just her day, which provided added benefit of stress reduction. One thing I'd like to note just about the coffee consumption, this is a known trigger for people who have fibrocystic breasts and pain. So I think that was actually a big trigger, and that was one of the things that had changed for her in these last couple of years, as I mentioned. So we just had her follow up, and looking at her symptom diary, we saw she had 75% improvement in just a couple months. Sometimes people with hormones, it might take 3-6 months to really get symptoms resolved or see a change, and this happened relatively quickly with just some little tweaking. So she's still on the journey. We made a couple tweaks now with her treatment plan, and I'm looking forward to seeing her in another few months. And then here's just a quick case for you. Had another patient. This was a 20-year-old female. She had irregular menses. So that meaning her cycles, some days it was, she'd have a 22-day cycle. The next cycle was 44 days. She also had significant amount of acne. She was starting to develop some scarring. This was obviously concerning for her. She's our gynecologist, and she was put on birth control. She's a very well-researched young woman. She actually started doing her own research, and she self-discontinued her birth control back in the fall. But when she did that, her period never came back. So she gave it a little bit of time, and it finally brought her into the office. And she said, okay, well, we got to figure this out. I had irregular periods before, took the pill, stopped the pill. It's been, 6 months now, and sometimes it can take a little while for periods to come back. But, after 6 months, we would expect that, cycles would come back. We did a complete thyroid panel, not just a TSH, but we did lots of thyroid markers, all normal. We did a metabolic panel, looks at kidney function, liver function, all normal. We also looked at prolactin, which is one of these upstream hormones, helping to kind of signal downstream for the hormones to be produced. That was all normal. Progesterone and estradiol, two common female hormones, also normal. Where we saw the change was her testosterone was elevated. Now, all women have a certain normal level of testosterone. When it gets too low, they might suffer from symptoms of lack of libido. When it becomes elevated, it can signal some other conditions to us. But elevated testosterone one of the main symptoms of that could be acne. Also, hair growth is another symptom. I don't believe she was having any excess hair growth. We also looked at the LH and FSH. These are hormones that we can look at basically to look at how overall function, the ovaries are being stimulated. And when we looked at those, the ratio of those two hormones was elevated. This finding, along with the testosterone, gave us a diagnosis of something called polycystic ovarian syndrome. So polycystic ovarian syndrome has a few characteristics. Sometimes there can be fertility issues, but one of the keynotes is irregular menstrual cycles or signs that there's elevated testosterone. So that could be acne or hair growth or laboratory markers that are changed. They may have cysts on their ovaries, but they also may not. But one of the key characteristics of this conditions is that it really is a metabolic issue. So there's a whole host of things that can go along with this. This patient, I also just recently followed up with her. We did just a few simple treatment changes with her. I had her start on something called Simplex F. This is it's a phytomorphogen. It's a product that helps to get the body to produce, to start to regulate its own production of its hormones and help to support the overall process that's happening there. OvaBlend, this is actually just a formulation by one specific company, but more importantly, it's what's included in it. Main active ingredients we see are green tea extract, nettles, saw palmetto, really helpful for bringing down testosterone and balancing out the hormones. And then I also did something that's called seed cycling. Seed cycling is this process, remember I mentioned about helping women to, if their cycles are irregular, we can get them cycling according to the moon. So you use different seeds to support different parts of the cycle. So in that first part of the cycle, in the follicular, flaxseed is something that can be really helpful for regulating that first half. Pumpkin seeds can be helpful. And then during their luteal phase, doing sesame seed and sunflower seed. So grinding the seeds up will help to release the essential fatty acids, but they both support the cycles during when the estrogen and progesterone are peaking. So I had her start doing that according to the moon cycle, not her own cycle, which was a little bit wonky. 6 weeks later, this was actually one of the quickest cases. She just actually messaged me, this was maybe about 4 or 5 weeks ago now, she had her period. So true success case. Her mom was elated. They had it on a tight window. They said, hey, if we don't get these periods going, maybe we're going to have to go back on the birth control. I said, don't worry, just give it a little bit of time. I asked her to give me 3 to 6 months. We put 6 weeks later. So she's doing fantastic. So hopefully you can see, just those are a couple cases of many where we just see the success of naturopathic medicine, taking a holistic approach and working with patients. There's so many more cases that we can look at in working with women. And I can't speak highly enough, and it's such a privilege for me to be able to get to see patients and see them make such changes. So I think this really kind of sums up, why naturopathic medicine. That's, when patients are an active participant, they have more long-standing improvements. They have control of it. So they start to begin to fill their own toolbox and know what they need to do to be able to, feel better. And that's a process in getting there. I would say to any of you, I know many people here that are on the call are exploring naturopathic medicine as a potential career. Some of you might be alumni yourself, and many of you might be patients or prospective patients as well. But if you're considering this as a career, just find your passion and open yourself to possibilities. I never knew I was going to fall in love with the cervix. And now, it's such a joy to work with women. And then lastly, if this is your career, the specialty in women's health for me, it fosters an expertise in a specific area. And having that designation, I am constantly staying on top of new information and exposed to new cases and doing research and more research and learning and learning and learning. And that's why they call it practice, because we're always practicing. And patients are always being patient, right, with their health. It's not quick fix medicine. It improves patient outcomes. It helps our own personal growth. It also helps for marketing. Patients have a connection. Hey, why do I come to you? You just treat everything? Well, we do, but we've got little areas that they can connect with. I didn't mention, but I have an area that I'm also passionate about. It's working with women who've had abnormal pap smears or HPV. Which affects about 85 to 90% of women. And so I offer some natural treatment alternatives. We're hoping to get some research and case studies published. We have about 95% success rate in helping women to avoid LEEP in their treatment of cervical dysplasia. And we're also beginning to launch. I'm launching a drellenlewis.com, which is it's called the Love Life program. So that'll be coming out soon. So program, there's maybe not a lot up there now, but we will be sharing that in the upcoming weeks to come. And as a profession, we're really growing. Patients are asking for this. Functional medicine is on the rise. There's more practitioners that are out there learning holistic modalities. I think we're going to see more specializations, more associations. The AANMC, which is the Association for naturopathic physicians working with cancer patients. I think we're going to see more and more about that. Okay. Well, it's been a pleasure speaking with you. Encourage you to reach out, follow me, and we'll open the floor up for some questions here.
Thank you so much, Dr. Lewis. Before we do that, would you be able to, I'm going to actually switch screens really quick and put up the events.
Mm-hmm.
Just give me a second while I'm doing it. Go. So if you're enjoying this, we have 3 new events coming up. June 20th is an event in sports medicine. The ND Experience at the AANMC conference is happening on July 14th, and this is an in-person opportunity for you to go and see what a day of being an ND is really like. And then we've got another webinar in July on naturopathic cancer care, from risk reduction to survivorship. And so we're really excited about these upcoming events. And with that, I will start the Q&A section. So thank you all. Dr. Lewis, the first question that came in was in regards to your last case, and there was a question about hypothalamic amenorrhea, and if you looked into that in your differential and how you would understand if that was going on.
Yeah, absolutely. I was just kind of summarizing some of the lab findings there, and we did a really comprehensive workup with this patient.
Thank you. Can you maybe speak to some of the biggest challenges in addressing women's health?
That's a good question. I think some of the challenges come in. Really, it's how we've been, as a society and as a culture, to understand how medicine works. Our expectation, I'm not saying my expectation, but the general expectation is you go to the doctor with a boo-boo and the doctor gives you a pill and it fixes the boo-boo. And so when patients are coming in to see me, okay, sure, we could just give a pill and fix that, whatever that symptom is. You have a headache here, take a pain reliever. But to actually get to the root of the issue, we have to do a lot more evaluation, and it oftentimes requires a lot of changes on the patient's part. It's a much more proactive. And so some patients aren't going to be ready for that. So it's up to me to be able to help be their, in so many ways, I'm their coach and their cheerleader with this. And, we use that whole intake process. It also gets the patient kind of thinking about their health, starting to bring some awareness and some, just some feeling of that they have a sense of control over that. That's a great question. I would say that's my biggest obstacle, and not really as it just pertains to women's health, but just in health in general, especially with this new paradigm that we're bringing about.
Thank you so much. So along the lines of patient questions, can you speak a little bit to insurance coverage and specifically to some of the labs that you run?
Absolutely. So, as it pertains to insurance, many states are licensed for naturopathic medicine, and that's usually a qualifying factor for whether insurance, is going to do some reimbursement or coverage for the patient visits. But we find that in many states, patients are able to get insurance coverage. There's many doctors that are in network with insurance companies. Personally, I'm an out-of-network provider. So what that means is patients can reimburse, or they can submit. We do all of the coding and everything for them to submit to their insurance panels for possible reimbursement. It just really depends on what their coverage is. One of the biggest obstacles, okay, to add on to the last question as well, is that patients are having higher and higher deductibles. So whether they see an in-network provider or an out-of-network provider, we're finding that they're so far off from their deductibles, especially at the beginning of the year in terms of the office visit. Now they can use flex spending, health savings accounts, all of that, no restrictions on that. And as far as the lab tests are concerned, I always refer to their in-network labs. So if I'm running basic, labs, hormone testing, things of that nature, usually most of that is just covered at whatever their lab coverage rate is. If we do any specialized testing, many of the companies have, they work with the insurance companies, and they often offer, some pseudo-subsidized coverage of those tests. I am very conscious of people's finances when it comes to testing, and really know how to navigate. And I would say that's true of many providers, so that, I really try to keep everything, within their budget, and and prioritize things based on what it is that we actually need. So, it varies person to person. Our office team works with patients. We, we find out what their situation is, and, we work with the insurance company to figure out so that patients really know what to expect. And that's unlike many. I just went to another doctor the other, I got a bill in the mail. It's like, I didn't know what it was going to cost. So I guess that's one big difference as well, that we really want patients to know that up front.
Thank you so much. Can you speak a little bit to the integrative model in healthcare and how you work alongside or refer to other providers like physician assistants, medical doctors, oncologists, obstetricians, et cetera?
Yeah, that's an excellent question, and I'm sorry I didn't mention that. That's actually a big part of my, my relationship and working with patients and other providers. I really emphasize for patients a team approach. So I'm frequently on the phone with their primary care physicians. I mean, I just had a patient this morning. I just recently had a conversation with her. I had referred her to an orthopedic doctor, and had a lengthy conversation so that patients know. A lot of times doctors don't have time for this, and it's a disservice to patients because they go to one provider, they say one thing, the other provider says the other thing, and one of the complaints is they go in and they spend the first 15 minutes just kind of familiarizing themselves with their chart, remembering who they are. So I do actually help people. I help patients with doing coordination of care. So that may involve phone call, like especially when I have some patients that are very ill, some that are just regular ailments, but whether it's coordination of care, letters, or talking to the providers, just so we all understand what our role is and what we're providing for the patient. So I've got some wonderful endocrinologists. I've got some wonderful gynecologists that I refer to. I don't do procedures in my office. Some naturopathic physicians who do women's health do colposcopy, biopsy, endometrial biopsy, things like that. I don't do that in my office. I all of that out. So I use a lot of different specialties. It's a part of practice, and that's something that takes time to develop depending on the community that you're in. But every time a patient comes in and they tell me about a good experience, a patient told me about a podiatrist that she had seen the other day. I'm looking for a great podiatrist, and so I called the podiatrist on the phone, and we ended up, I went down to the office. We just chatted for 15 minutes, got to hear about his approach, and I just got a great working relationship. I find that all of the conventional medical doctors that I'm working with or specialists, really receptive. I mean, they're so happy that patients are getting care here and, working on other aspects of their health that maybe they're not able to address in their visit. So great question.
Would you maybe go into a little bit more detail on how NDs work to find out the root cause of what's going on?
Okay. Yeah. I think, take something, I mean, we just talked about some cases about, specifically with hormones, but, take something like, I mentioned a headache. If somebody comes in for a headache, certainly has it new, was there a trauma? They might have seen a neurologist, they might have had an MRI, they've gone through their typical workup, and let's say everything's fine, they can't find any reason for why this person has these headaches or migraines. The treatment of choice that they're going to give that person at that point is really pain management, or a variety of different medications, and they're just going to find, oftentimes what works. And there's a time and a place for that, Of course, if a patient is in that place and that's what they need at that moment, I'm not, anti, medication, but there might be something underlying that. And I think just in this last week, I mean, I had a half a dozen new cases of headaches and migraines, and they're all for different reasons. So part of that workup and finding the root cause, you have to have the story. One patient also had chronic fatigue. She had a history of Lyme disease like 15 years ago. Well, it ended up that she actually had Lyme disease was still present. We tested for it. So whether it was a new infection or an old infection that reappeared. So that was her case. So now, she's transitioning into treatment specifically for that and all the sequelae of that. Now I had another patient who hers was hormonally related. So all the stuff that we just talked about today, we did some testing and evaluated for that, or just getting their story and finding out connections in their history. Another patient also had some digestive symptoms, some skin rashes, some things that were pointing a little bit maybe more towards allergy. So we did some food allergy testing. She ended up having food allergies that were triggering. There were some dyes and additives that we found. So, the evaluation and getting into the root cause, it's looking at, it may be labs, but that's not the only thing. I think sometimes we rely so much on the labs, but that really rules in and rules out what we're already thinking. And so I think that goes back to what I was saying about doing that investigative work through our intake and really hearing the patient's story. A lot of times they just haven't been able to explain their whole story. And being a physician, there is a certain element of art and intuition that goes into it in addition to science. And so a lot of times that intuition and that art of medicine can get lost. So that I try to bring back into, what it is I do with patients. And another one I should mention was a musculoskeletal. She had, we ended up doing some physical medicine, some manipulation. She had some muscular imbalances. It's all coming from neck and low back. We did some natural therapies that can work as antispasms, working in Epsom salt baths and magnesium. And this was just in the last week. So, we'll see where all these cases go. But that's just one example that something can go, obviously they want to get we want the patient to get the appropriate workup to rule out the big bad scaries, but sometimes it's not the big bad scaries, it's these other things that are going on a more structural or functional level, that it just takes some time in working with them. So that goes back to that group of patients that I mentioned. It's like this one group that's just frustrated. They've been to all the different doctors, and they've had, every scan and every test imaginable, and, tried all these treatments, and then here they are, So good question.
Thank you. We have a specific question about high testosterone and what you've seen be successful. I know you mentioned Vitex, but can you talk a little bit about testosterone? And, a lot of times people think of estrogen and progesterone for women, but not so much testosterone.
Yeah, that's a good question. And especially when we see patients that are on the higher end of testosterone. I see lots of patients, and especially in their, perimenopausal years, where they might be running low in testosterone or in their free hormones. So it depends on where their testosterone or what's being affected. So different ways we can look at testosterone. So when testosterone is circulating in the bloodstream, it's called total testosterone. So testosterone is kind of bound up to this carrier. It's imagine testosterone's this little person on a bus, and the bus is called sex hormone binding globulin. That's the carrier, and it needs that carrier to circulate around the bloodstream. And then when it gets to where it needs to go, it jumps off and it becomes a free testosterone. So it's important sometimes that we're looking at the total and the free hormones, because sometimes somebody can have an elevated total testosterone, and that might be because they've just got too many, they've got too many buses that are going around, or they might have their free testosterone might be affected. So it might be low because, again, they have too many buses that are just binding it up. So if that's the case, there's different things that can be effective on, working on the carrier, the sex hormone binding globulin. Things like flax and zinc, depending on which way you're trying to push it, can be effective there as well. But in addition to testosterone, remember, testosterone is when we look at the biochemistry in hormone production. When we go back to, and this isn't even the starting point, but cholesterol is kind of the building block of hormones, and then cholesterol goes down this whole pathway. It eventually, it goes down into progesterone. It also goes into what's known as DHEA. DHEA becomes testosterone. Testosterone then becomes estrogens. We have different forms of estrogen that are occurring. That cholesterol also can go down the pathway of cortisol, and there's all intermediary steps in there. So oftentimes I find it's helpful. If we just want to block testosterone, there's, prescription testosterone blockers. We have natural testosterone blockers, such as the ones that I mentioned that can be helpful. The saw palmetto, nettles, things like that can be helpful for bringing it down. But it's important to look at what's happening upstream and also what's happening downstream. So is this a case of a person like everything's elevated? Where is it coming from? And so it really depends on what's going on with the patient, but I might do some in-depth evaluation there so that we can, again, if we're really getting at the root cause, if it's just high testosterone, I don't always just want to stop testosterone, because as soon as you stop doing that treatment, then what's going to happen to their testosterone? It's just going to go back to what it is. So we've also got to figure out where that imbalance is coming. It just gets harder and harder. So more and more work trying to figure these things out. You always ask these questions, but why? Okay, well, why is that way? Why is that way? And, you never know. It's, where you're going to go back to.
Well, and I think you bring up a really important point that, and one of the things that I know so many NDs really love about being an ND, which is that we're kind of like health detectives. We're asking why. When I saw patients in clinic years ago and used to supervise medical students, so my last name is Yanez, and they always used to joke that my last name should be Dr. Y, W-H-Y, because I always pushed them and I said, why? Why is this happening? Don't stop until you figure out the why. And so earlier there was a question about, estrogen and birth control, and pain and the relation to pain meds. But I said, why is the pain there? Until you figure out, what that pain root cause is, that's the gold spot. And so I think that, there's a lot to understand with naturopathic approaches, but that we really are taking this very patient-centric, individually focused approach. And so we can't really give, a one-size-fits-all answer for things. But there are a couple more questions that I want to get to before we close out on time. One is just, the reality that, supplements and some of these therapies can be expensive. Not all of them are always going to be covered by insurance. And so do you see NDs, especially in cases like that, focusing more on food as medicine? And how do you incorporate food as part of the medicine that you provide patients in the therapeutic plans? And obviously, you talked about caffeine and the important role of coffee and and hormonal synthesis and what have you. But I think that would be a good thing to extrapolate on a bit more.
Yeah, so, listen, it's always, when I'm talking with patients, my preference, and that's, where I kind of started this talk, my foundation is diet and lifestyle. I think much of where our symptoms fall, really kind of traces back to, what we're doing in a day-to-day. So, it all comes down to what's a patient willing to do, and that's one of the questions I asked on my questionnaire. It's like, how willing are you to make diet changes? How willing are you to blah, blah, blah. And, we get at some of the emotional aspects around that and making those changes, but there's a certain reality with things, where people are. I mean, stress is a part of everyday life. Different situations might impact what a patient is able to do, and we have to take that into consideration. So when diet recommendations come into play, for instance, let's say DIM. This is a common treatment that you'll hear of practitioners prescribing for, health or hormonal imbalances. I use it oftentimes with my patients that are having what we call more of like an estrogen dominance. Diindolylmethane. It's a phytonutrient. It's derived from vegetables such as broccoli, Brussels sprouts, cabbage, kale. That also actually blocks the androgen receptors. So that, going back to that question about lowering some of the testosterone. Anyway, a patient, to get, a therapeutic dose, which is studied, where we look at the studies and the use of DIM for some of these symptoms or ailments. A patient might have to eat like 6 to 8 heads of broccoli a day. I mean, even a head of broccoli a day is a lot, but, we start to ask, that's like, well, what, if I want them to take 200 milligrams, versus 100, like, are they going to get some broccoli in their day? And, that will adjust our dosing accordingly. But, we start to have that conversation. Or green tea, green tea has lots of, health benefits, or I might use that for certain ailments, but, patient to get in 6-9 cups of green tea to get a therapeutic effect from it. They might also be dealing with, side effects where it might be, causing them to feel a little racy, so we just weigh all of those things, and we have dialogue about this. Another thing is, maybe somebody's having a hard time digesting their food. So there's different ways we can stimulate digestion. So smelling their food cooking is a great way to stimulate the salivary hormones. Smelling a lemon, drinking a little lemon juice, a little apple cider vinegar, this can stimulate the stomach acid. So I can prescribe that for somebody, but when they come in for their follow-up and we say, okay, how are you doing with that new plan? And it's like, my symptoms are somewhat better, but not really. And we really uncover, it's like, okay, well, what in the plan have we, maybe how were they implementing the plan? And you find out that they weren't able to implement, that treatment. So we might look at some digestive enzymes or something like that. So they have options is, certainly that most of what we do, we actually can do through diet and lifestyle, but it just comes down to what they're willing to do. And that factors into the cost as well. And we weigh all of that out. My goal is not to have somebody take 1 million supplements every day of their life any more than don't want them to take, 1 million medications for the rest of their life. If we're really establishing true cure, they shouldn't need to take anything. They should be able to sustain it without having to take those awesome medications or supplements.
Thank you. One last question. Can you talk a little bit about naturopathic approaches to infertility?
Oh, absolutely. Wonderful case, actually. This young woman was just in here with her little baby this morning. Case of infertility. She had been trying for 5 to 6 years unsuccessfully. She had done IUI a couple of times, and she was gearing up for possibly IVF. We went through, this is one case, but we went through, all her hormones were perfect. Everything was fine. It was just a case of, unknown reasons. And this can sometimes happen with patients with infertility. And remember, we're not always looking at female factors. It can be male factors as well, which I have more cases about that too, but this is just one that popped in my head when you said that. Interestingly, we went through a lot of her, nutritional or testing, and really the only thing that came back with her was iron deficiency. She wasn't anemic, but remember when we test labs and screening for, when they look at the blood count, they're looking for anemia, but that's the very end stage process of nutritional deficiencies. So when you start to lose iron in the body, you start to use up your iron stores. Eventually, then the cells start to shrink, and then you'll be diagnosed with anemia. But there's different ways that we can look at it to see, well, hey, which way are you going before you're anemic? She wasn't anemic. But she followed followed a vegan diet, and I work with people. I have many patients who are vegan, and we just do what's right for them. I'm not, that's usually the next question that follows a statement like this is, am I pro or anti-vegan? I'm pro what's right for the patient, and there's different considerations and different conditions we might consider both. But anyway, one of the changes we had her do was, incorporate some red meat in her diet, and she was willing to do that. And she ended up that, and we just did some really gentle tonifying treatments. She was also working with acupuncture. I don't do acupuncture here, but one of my other providers does. And a few other just gentle therapies to help her. Within a few months, she achieved a pregnancy. It was the first time she was ever pregnant. Unfortunately, she miscarried shortly after that. However, we were like celebrating. We're like, woohoo, the parts work, you can do it. And you know what? Guess what? A few months later, she got pregnant again, and now she's got a healthy little baby girl. Beautiful. She was just in this morning. So I don't know if that, it's hard to answer such a broad topic such as infertility in such a short amount of time. There's so much we can do. If they've got the parts, if they've still got them, we can make it happen a good portion of the time. So much we can do.
Well, Dr. Lewis, I know that we're at time right now. I really appreciate you spending your hour with us and speaking to the students here and folks that are interested to learn more. And so I know that you put your contact information up earlier. I'll just throw that up one more time for anybody wanting to reach out to you directly. And with that, we'll conclude our webinar. I'll stay on and answer some additional questions. And as always, you can email or contact AANMC, and our contact information is up on the screen now. So info@aanmc.org, our phone number as well. And really appreciate you all coming to spend time with us today. And Dr. Lewis, again, thank you for hosting this webinar.
Absolutely. Thank you, everyone. It's been a pleasure speaking with you.